Welcome to today's session on trying since 1 year, not successful. What's next? To speak on the topic, we would like to welcome Dr. Anuranjita Pallavi, our in house infertility specialist. She has done her MS, OBG, and FRO. We welcome you, Doctor. Kindly take over the session.
Thank you so much, Smriti. Hi, I'm Dr. Anuranjita Pallavi, consultant at Apollo Fertility, Navi Mumbai. I have taken this topic. This is a very basic topic, and I have taken this topic to make people aware as to when should you visit an infertility center. When is the time? Is it too early? Is it too late? When should we visit? So that is why my topic for today is trying since 1 year, still not successful. So what is next? What happens is, see, whenever a couple comes to us, with not being able to conceive, so how do we categorize them into a case of infertility? Do they require further evaluation or not, is based not only on one parameter but a lot of parameters we take into consideration. For example, but the most important definitely is the age of the woman, especially the age of the women. You know why? Because women are always born with a certain number of eggs which keep on declining with age, both quantitatively as well as qualitatively. And this decline in the quality or the quantity is very rapid after 35 years of age. So when a couple walks in, and they say that they have been trying since a year, so definitely for a couple, for a female, or for a couple who's 35 years and above, the duration of natural try, what we take it is at 6 months. So if a woman who is 35 years of age, they have been having regular intercourse at least 3 times a week unprotected, minimum for a period of 6 months, and still if they have not been able to conceive, then we definitely ask them to visit an infertility clinic, get all the baseline evaluation done, and then the treatment can be guided as depending upon the reports. However, this is, when a couple is aged. I mean, when a couple is 36, 37, or, between 35 to 40 years and above. But if you look at a proper definition of infertility, when do we categorize a patient as infertile? Or, infertility means inability to conceive. What is the exact definition is when a couple has been trying at least for a minimum of 1 year of unprotected intercourse at least 3 times a week without protection. So this is the category. So if you have been trying, it is if you have been trying for 1 year unprotected intercourse for at least 3 times a week and still not able to conceive, then you definitely need to visit an infertility clinic and get all the baseline evaluation done. And then depending upon the reports, then we can guide you as to whether you just require something. Suppose a patient who's around 30 years or a couple who's around 30 years of age, the women, they have been trying since 1 year, but then the catchy point here is she's not getting her regular periods. So when we evaluate, in the evaluation, for example, we find that she has PCOD. So in those cases, we give them, see, infertility is not always IVF. There are a series of treatments which we try in a patient before we ask them to go ahead with an IVF. There are some reasons which I can say that there are direct indications for an IVF, like both the tubes are blocked, that the sperm count is low. But apart from that, if everything is normal, if the couple has been trying for 1 year and still not been able to succeed, then a baseline evaluation is done for those patients. And then depending upon the baseline evaluation, at least we tell them to start on, if everything looks normal. Suppose, but for example, if she has PCOD where she's not ovulating, or she is not ovulating, and or she is ovulating, but the exact time of ovulation is not determined. In PCOD, this is a common thing. We have two types of PCOD. One is an ovulatory, one is an anovulatory. So especially in an anovulatory or even in an ovulatory, it is very difficult to determine, when is the patient ovulating. So that might be, or you might be missing the window period, the fertile window period. So for a 28 or a 30-day cycle, we say that, just have alternate day relation from the 10th day of your periods for the next 15 days. So that is normally what we say. But then the patient might be ovulating late. Or what is the situation when the patient ovulates at 30 to 35 days? When the period cycle is delayed. Suppose, for example, 35 to 40 days cycle. So in those cases, it is very difficult to determine the time of ovulation. So in those patients, for example, we find a PCOD in a patient where the ovulation time cannot be determined. So in those cases, we can go, and if the semen parameters are normal, then we can go ahead with simpler treatments like ovulation induction, where we and follicular monitoring. If the semen analysis is normal, then they can go ahead at least with a natural try for at least minimum monitored cycle for at least 3 months, 3 to 6 months. So that is how we follow. And 3 to 6 months, if they have not been successful, then we go ahead with an IUI. And if all the reports are normal, for example, we have evaluated all, a couple has come who's 31, 32 years of age, they have been trying. See, staying together and trying since 1 year is different. They have been staying together, but they were not trying for kids. In those cases, we don't take, suppose they were married for 5 years, but then they have been trying, recently. So in those cases, we do not take them as infertile couple, that they require an evaluation, because the duration of stay, together does not matter. It depends only on since how long you have been trying for pregnancy. 6 months, 8 months. That is how we determine whether, we should evaluate you, we should go ahead with the treatment management or not. For example, another scenario is where everything is normal, and they have been trying since 1 year. They are 31, 32 years of age. So we at least ask them to go, because 1 year, 80% of people who have been trying since 1 year conceive within that 1 year. Next year, the rest 20% of people conceive. So if they, at least they are not able to conceive, that means there is some problem. But then that is why that evaluation is required. So definitely we recommend that, especially if the women is less than 35 years of age, trying since 1 year, regular unprotected coitus at least 3 times a week, not able to conceive, yes, comes under infertility. And then we do the baseline evaluation and find out where the cause is and what is the cause of infertility, and give them the further line of management according to what the reports have come. Secondly, definitely the age criteria is very important. As I previously said, 35-year woman or 35 above 35 years, the duration of try is reduced only to 6 months. If they have been trying for 6 months, not able to conceive, then we definitely categorize them as, further evaluation will be required in those cases. And in general, if they are not able to conceive, irregular periods, they have been trying since 8 months, 9 months, individual cases are again dealt with. But then if I have to categorize them into two broad categories, less than 35 years of age, trying since 1 year, not able to conceive, visit an infertility clinic for all the baseline evaluation tests, and let your doctor decide which will be the best line of management. And always we have to evaluate the couple as a whole. It's not that we evaluate only the woman, because sometimes, the woman might be normal, but then the semen count might be 1 million, 2 million. So definitely the evaluation, when I say evaluation of the couple, it has to be both. Both the male and the female testing should be done. And above 35 years of age, 6 months of trying, not able to conceive, you can visit an infertility clinic for all the baseline evaluations, and then your doctor can help you out as to which treatment we should go ahead with. So these were the broad categories of when do we, what should we do next, and every time this question runs in our heads, it's been 1 year, is it the right thing that we are doing? We are still waiting, we are trying since, because we get couples who have been trying for 6, 7 years and not been able to succeed. And in this problem, they have crossed that age of good egg quality, and then we are left with very restricted options. So what I would suggest is, visit an infertility clinic till there is time, because if you've been married for 6-7 years, not going through simpler treatments, the couple has not been evaluated, we evaluate both of them together, and depending upon that, we can offer you the best treatment which is available. So this was a small topic, and but then a very important topic as to when to visit, when to take an action, when should you go ahead for all the investigations. This will give you an idea about that. Okay, so that was it, I think. Thank you so much. Yeah, thank you so much.